my name is Christina. I'm a nursing student from St. Martin's University, and the doctor ordered a central line dressing change. I'm gonna open the chart here, make sure we have right orders and right patient. May I verify your name and your birthday, please? Jennifer Garner, birthday 10/18/1983. All right. And do you have any allergies? No allergies? All right, thank you. And there is an order for a dressing change. So the doctor ordered a dressing change just to make sure that the central line is still patent or usable and there's no signs of infection or any discomfort. You may experience some discomfort, but hopefully that won't occur. Is it okay if we proceed? All right, thank you. I'm gonna perform hand hygiene, get the bed up to a working height. All right, I'm gonna lower this side rail. Get my stuff over here. So I already performed hand hygiene. I'm gonna put a mask on you, Miss Garner. This is just to protect the site while we're getting it changed, so there's no introduction of germs or organisms. And I'll ask you to turn your head away. I'm gonna put my mask on and my gloves. All right, and now I'm going to assess your site. It's over here on your right side of your chest. All right. Make sure we got you exposed, but not too much, so you have some privacy there. All right. So upon looking at the site, I don't notice any redness, any swelling, erythema. If there's IV fluids running, I would put those on hold, connect the fluids and clamp the line. And then I'm gonna palpate around the site of the incision, noting any increased warmth or any tenderness or discomfort the patient may verbalize. I'm gonna stabilize the hub of the catheter and pull the dressing up in a perpendicular motion towards the site, noting any discomfort the patient may verbalize or the subjective signs that she may be exhibiting. How are you doing, Miss Garner? All right. And making sure to not dislodge the catheter, maintaining the stabilization device. Throw that in the garbage. And I would remove the stabilization device. Also making sure not to remove the catheter. So I'd put that in the garbage. And then I would again assess the site, noting any drainage or any infection. If this was a PICC line, I would measure around the site of the incision and notice if there was any thrombus. And if she did have a PICC line, making sure that her arm was below the level of her heart. Also noting if there's any staples or sutures in place to keep it stabilized. Now I'm going to get my sterile field ready. I'd perform hand hygiene. Get my supplies over here. Oh, I'd make sure that I had privacy for the patient. All right. I'm gonna get my sterile field ready. Still doing okay. I'm gonna open my gloves. Get my dressing out. Grab these. Open my biofilm. All right. First, I'm going to take my chlorhexidine. Not my chlorhexidine. My antimicrobial cleaner and clean around the site of the incision to clean any drainage or blood, dried blood. So I'd go in a circular motion around the site to get that cleaned up. Next, I would get my chlorhexidine. Make sure to pop that, and in a 3-inch area, I go back and forth to clean the site for 30 seconds. Allow that to dry. And if per policy, I would get antimicrobial dressing and place that, but we don't have the antimicrobial dressing, so I would get the biofilm. And take my biofilm. Put my biofilm on somehow without breaking my sterile field. Oh my gosh. All right. I'm gonna take my dressing. I don't know how to put it on. I'm going to place the dressing. All right. Now I'm going to remove the old adapters, but first I'll place my drape. And I would do this with every lumen. I would remove each adapter and place new adapters. I would take the old adapter off. Of each lumen. And with my antimicrobial cleaner, I would vigorously scrub each lumen. And place new adapters. And with the new adapters, with my antimicrobial, cleaner, I would clean the hubs vigorously and allow that to dry in between each cleaning. I would take my flush, and depending on facility, I would either flush with 3 mils of normal saline or 3 mils of heparin. So I flushed each lumen with 3 mils. I'm going to unclamp and flush some saline, noting any resistance, and then I would draw back to get blood return. If there was blood return, I would either flush the saline over a minute, or I would do 1 mil boluses 10 times in a pulsatile motion. So there was no resistance noted, but if there was resistance, I'd report that to my nurse preceptor and the doctor, potentially even the lab, to see if they can come in, work their magic. Again, I would clean vigorously with an antimicrobial cleaner, and then flush again, flush the site again, clamp that. I'd flush each line, noting if there's any resistance, making sure there was blood return. If there was fluids running, I would hook up the fluids, unclamp the line, verify that the rate was correct with the pump, and restart the fluids. I would take my gloves off, perform hand hygiene. I would date, time, and initials of when the dressing change was done. I would get the patient in a comfortable position. I would remove her mask after hand hygiene, clean up my area, throw that in the garbage, get her in a comfortable position, her call light. I then would remove my mask as well. I would document the site, location of the dressing change, any patient teaching, patient's verbalization of any discomfort or not tolerating the procedure. I'd also document subjective indicators of any discomfort or not tolerating the procedure, what materials I used for the dressing change. I believe that's all. I'd get the patient back in a comfortable position, their call light, their personal belongings. I'd throw my trash away. Thank you, and skill.